Hey everybody, how are we doing? This is Dr. Ruben Valdez on yet another great episode of Under the Avocado Tree. Today I have the privilege and the honor of being joined by Sabrina Dvorak. She is a certified nurse practitioner out of Colorado who has taken it upon herself to continue just studying and studying and studying, getting to the point where she is now fully certified through the Institute for Functional Medicine. Her health career really started, or interest in healthcare really started for her as a child, like 3 or 4 years ago, right, Sabrina? And from there, she evolved into going to a pretty prestigious university, Kansas University Medical Center, became a registered nurse. She worked there in the intensive care unit, worked in pre-surgery, post-surgical recovery, and just kept studying, learning, went out to be a family nurse practitioner from Regis, where she was the summa cum laude. Is that right? All right.
Yep.
Awesome. And so she is extremely passionate about healthcare. She herself has a incredibly interesting healthcare journey. And part of that journey is what's taken her to dig so deep into a lot of the pathways that we're going to talk about today. Now, before I let you introduce yourself, Sabrina, a quick, introduction as to why we're going to have this conversation today. Right now, the country's basically on lockdown. Everybody's, stuck within their homes, quarantined, and those that are not, are going to work, doing the bare essentials and running back home. And unfortunately, there is, for many of us, a threat that can live within our homes. And sadly, for some people, being in their homes for their health could possibly be the very worst thing that they can be doing for their health right now. And I know that sounds daunting, it sounds panicky and alarming, but it is a huge, huge reality. So today I want to unpack that with you. So before we begin, tell us a little bit more about you, Sabrina. Help us understand your journey and how you've gotten to the point that you're working now in this field of biotoxin illness.
Well, thank you for the introduction. I would say my journey started with my mother being ill, my childhood. Just watching different doctors try to piece together her illnesses and mostly failing, to be honest. She suffered a malpractice lawsuit and has been sick basically my entire life. And I always kind of felt like it was my journey to help figure out what was wrong with my mom. Like, how can I fix my mom? And seeing that there's so many other people out there that have illnesses that necessarily can't be explained by other doctors, or have just been passed from one doctor to another one, put on prescription after prescription, with side effects after side effects. And really their quality of health never improved. So I went to nursing school, I became a nurse, was noticing that I was treating really sick people. The people we were just giving more medicines to, we were doing a lot of surgeries that didn't seem like they needed to be done. So I needed to figure out another way to help people because I was just on the receiving end versus a preventative end. So I went to nurse practitioner school. I loved nurse practitioner school, but I felt like after school, I was still kind of that person that only saw the patient for 5 to 8 minutes and then had to give them a prescription because that's what they were looking for. And they'd keep coming back and no one was really getting better. They might stay the same, but overall they didn't improve to where I felt like I was doing much good. So I started taking classes with the Institute of Functional Medicine. I finished all the classes. I'm actually not certified quite yet, but I finished all the classes. So close. And really just started the journey because of my own thyroid issues and then how it led me to finding functional medicine and actually getting better. And then watching other patients get better using functional medicine as well. It just seems like finding the root cause of a disease is the best way to go about medicine for me.
Mm-hmm. So I know that when you and I have connected in recent times, you've developed this massive interest around mold toxicity, biotoxin illness, and some of the work that's come out of Richie Shoemaker. And I know that this has kind of evolved into a passion for you. Um, as we move forward, obviously, this is the threat that we are talking about, where people
Right.
now quarantined in homes, and if they're facing this stuff, it's a big problem. But help me understand how your journey has kind of led you to the point where this has become your jam.
So back in 2017, I was going to my doctor for thyroid and noticing that my thyroid, my TSH, my markers for my thyroid were steadily getting worse. And so the doctor put me on Synthroid, and I didn't feel well after. I didn't have any none of my symptoms changed, but my lab values looked perfect. So she didn't know what to do. So I went and sought out another clinic and got some help with that. But then I was going to my rental. We had people living in there for 4 years, 3 guys for 4 years. It was not a clean place. And I thought I was starting to feel unwell because of all the chemicals we were using, because we were in there like scrubbing the ceiling, the walls, the floors. I mean, everything had to be redone. What I remembered though is my dad, when he pulled up the carpet in the back room, there was a ton of black mold back there. And he's pulling it up, he's rolling it up. We're like, wow, we got to do something about this. We took care of it. But then I got really sick, and I was just like, it's just got to be the chemicals, because I know there was mold, but I didn't know mold affected people like it did. And I ended up with the worst GI symptoms you could ever imagine. I wouldn't wish that on my worst enemy. I mean, it was really bad. Not only that, I couldn't communicate. I started writing. My penmanship changed. I couldn't think of words to say. Like, nothing would come out. I'd be staring at a vacuum, couldn't think of the name, and the kids would be like, "What is wrong with you? Why can't you think of the name?" And I'm like, "I don't know." Just feeling super ill. And we started testing my immune system and found that I'm something called mold susceptible or multi-susceptible, which is actually, the worst variant that your genetics can have, meaning if I'm ever around mold, or if I'm ever around like a snake bite or spider bite or something like that, my body won't recognize those as being foreign. And so it won't create any antibodies against it to get rid of it. So this stuff just keeps circulating and circulating and circulating, and it just attacks different organs. Mine ended up being my thyroid and ended up being my gut. And then my brain also too. So it caused like close to 20 pounds of inflammation. If you can believe that, after treatment, I lost 20 pounds straight up, just like that, because of that. But that's really what led me to figure out, like, hey, if this is affecting me, and I didn't know this existed, what if it's affecting everyone else? What if it affected my mom? Like, maybe this is what started her whole process, because I got the genetics from my parents. Okay. So that's kind of how we got rolling on it.
So let me unpack that, because there's so much there, right? You present, you go to this place that is not your place, but it's a place that you had to go to. You're renting it out. They apparently didn't take great care of it, and all of a sudden there's a ton of mold. You're like, no, the chemicals, is it the mold? I don't know. And you start presenting a whole bunch of symptoms that you described as gastrointestinal upset. Like, what does that mean specifically? What did those symptoms look like?
Essentially, my body was creating an autoimmune disease in my gut. So without treatment, I'm certain I would have had colitis, like my grandmother had, or Crohn's. And so I had just intense swelling in the GI area. Every time I ate, my stomach was upset. I had pain in the rectum area, like hemorrhoids, like on steroids. They were so bad, and this was just out of the blue, like I had no idea. Like, I was fine a couple days.
To like
it felt normal. Terrible. Yeah.
Wow.
And I know it happens differently for different people. Those were just my symptoms when I
Yeah.
had it.
And so the GI symptoms seem to have been the first thing that showed up. And then you were also talking about cognitive symptoms showing up for you.
Right. So it started off GI. One day I went to the bathroom at work, and it was like nonstop after that. Like I couldn't stop going to the bathroom. And I'm like, what is going on? Did I eat something bad? But then I had this pain, and then I had the hemorrhoids come on, and just like this bleeding from my rectum. It was bad. And I was seeing the GI doctor. They had no idea what was going on, told me to do all these diets. Those didn't work. And then as that progressed, then I just noticed my brain wasn't functioning anymore. Like I was smart. I would be very good at telling people things that I needed to tell them. I couldn't tell them to do anything. I would just stare at people trying to figure out what their name was. I honestly thought I was going to have a seizure at one point. Like I was just like, I just have a really bad feeling about this. Mm-hmm. So it got pretty bad.
Okay. And you talked about genetics. So, first of all, for the people that might not know, would you be okay telling us a little bit about what biotoxins are, and then talking a little bit about, what if a genetic test is performed looking for that problem, what can that genetic test reveal?
So biotoxins are essentially an environmentally acquired illness. So you can get those from different things, like I had mentioned before, like getting bit by a spider, from bad fish, from the environment, from molds, etc., like that. So there's a lot of biotoxins. Lyme disease is another biotoxin, which is becoming more prevalent as well. So one way we can look for susceptibility in patients is to test their genetics. And what those genetics test is like for certain halotypes, basically, to see if you are one of those people that would be susceptible, meaning your body doesn't recognize. So that always kind of confused me at first, like, oh, you're susceptible to it. It was like, well, I'm susceptible because my body doesn't recognize those toxins in my body, so they won't ever get rid of them.
Right.
So we did do the genetic testing for me. I don't always do it for patients now, mostly because almost everyone I've tested for mold has been positive for it, using a different testing that we can go through later. But it was good to know, to find out that, wow, this is something that I have in my system, and I have to be a little bit more aware of my environment because of this genetic issue I have.
So from some of my own reading, Sabrina, I've heard, I don't know how accurate this is, and I've read in some of the papers that around 22% of the population, of the entire population, carries some type of variant that can make them susceptible to this type of toxin. And like you were saying, there's many toxins out there, from, I think you said, fish and spiders, or blooms, Lyme disease. But amongst all of these, really the most prevalent tends to be, indoors, the one that we live with, which is mold. So think about this, the entire world, at least the entire country of the United States right now, locked in their house, 22% of people carrying around genetic susceptibilities to the toxins that are produced by mold. And it's like nobody's kind of talking about this and alerting them.
Right.
Do you know what some of the things that a patient or a person that might have the susceptibility and have an exposure, what kind of symptoms, what kind of stuff should they be looking at or worrying about in order to maybe increase their level of suspicion that this is what's going on with them?
Well, I'm really glad to talk about this, because I have been thinking a lot about it as I've been stuck in my home. And just a side note, as it turns out, my home that I moved into it wasn't brand new, but back in 2014, ended up having mold in it as well. So I never saw the mold. It was just from a prior leak. So it was really interesting that is probably what started my decline in my thyroid function from the very beginning. And then when I went to my rental house, it put me way over my toxic load. So as I've been sitting here, in quarantine, have been thinking about people inside. And so some of the symptoms can be really mild, like acne or a rash that you've noticed that won't go away. You could have more brain fog, forgetting where you're going, why you went into that room, up to GI distress, some stomach pain. In adults, we see a lot of anxiety and depression. In kids, we see a lot of ADD, ADHD, and some oppositional defiant disorder as well. So the symptoms can range. A lot of the times too, you're maybe thinking, I wonder why my doctor can't figure this out, or I've gone to them for the same thing over and over again and it's still not getting better. Just like my thyroid started off that same way, just kept getting worse. So it's just good to pay attention to your body and question it and be like, I wonder if this could be related to mold in my house.
Mm-hmm. And once somebody presents to you, whether they're experiencing some of the symptoms that you just described, or they're the type of patient that's been to 3 or 4 doctors, nobody can figure out with them. Once they're there in front of you, what are some of the first things that maybe you hear that begin to create a suspicion of this for you? And then how do you proceed from there?
Well, my goal is always to prove that it's not mold. I'm like, please don't be mold. Please don't be mold. But because what we end up doing is checking the whole entire system. We look at the whole body, right? That's what functional medicine providers do. So we're looking at the toxic load. So when a patient first comes to me, I'm going to do a timeline of their life from, birth to where they are right now. And then I'm also going to look at where they were living during those times. If they've ever seen mold, been around mold, had a musty smell in their house, window leaks, grout tile, like if they have any of that looks moldy. So we go through a lot of different questions in like a normal practitioner's office would go through, but I'm trying to get a deeper level and really understand, when did you get sick or when did you last feel well, and see if it matches up on the timeline of maybe you were exposed at this house during this time. So that's my first step with patients. And then we go through a lot more testing. Sometimes we'll do the genetic screening, but more often than not, we'll do a urine test to see if there's metabolites of molds in their system. And we'll also do a test of their house too, using just an at-home dusting kit that they can send in, or sometimes mold plates as well, to determine the location of the molds. So there's a lot that goes into it, and it's very specialized to each person.
Very good. So to kind of veer off topic, there's probably a lot of people at home, right now, and possibly listening to us speak, if they have a suspicion because they're seeing these weird symptoms, or they don't feel, or they feel worse when they're at home than when they're not. Right. Or, what are some of the things that they maybe should consider if this suspicion begins to arise in them?
I would start by checking around your house. Look for spots that could have leaks. So underneath every sink, anywhere where there's a faucet, outside, inside, take a look to see. I usually send over an indoor environmental specialist to their house to take a look as well. Sometimes the molds are hidden and they can't see them. Also, they're really good at giving remediation feedback as well. It's a good time now to declutter as well. Like, let's get rid of some stuff. I mean, maybe there's some papers that got wet a long time ago, and those are full of like dust and mold particles, like things that you don't need. So the first thing to do is obviously contact a provider that knows how to handle mold to give you the best route, because there's so many different avenues you can take, and we've tried to make it as cost effective as possible, because it can get expensive if you really want it to, but using our tests determined to fit you the way it needs to be, like, usually is the best outcome.
Yeah, that makes a lot of sense. And Um, what would it look like if somebody meets the criteria, and let's say that in this case they're dealing with mold, it's confirmed, it's in their house. Begin to give us a sense. I know that this is hard to do because it can be so different from patient to patient, but give us a sense of what the process is like from taking somebody from being sick from their environment to moving them back to being healthy.
So it is a process, but it's a streamlined process for the most part. First, we want to open the detox pathways in a patient, make sure we're able to eliminate the toxins that are in there. Once we get those open, then we can use something called binders. Binders help. There's prescription binders, there's herbal binders. We can use a combination of both. I was just on the prescription binder, and that was a miracle drug for me. It's not for everyone though, but we pull those toxins out of the system, and then we want to eliminate the molds, right? So we want to eliminate the exposure to the molds. So we need to make sure that the house is going to be safe, that your car is safe, maybe that your job is safe. I learned the hard way that I needed to wash my dogs in a special shampoo because they were bringing molds in, and they were in a moldy house, and they couldn't get rid of it, you know, so we had to use a special shampoo to get rid of it. But once you take those steps and we're starting to detox nice and slow, you'll start feeling better. I mean, your brain will start changing, your symptoms will start improving. And it's a miracle. It feels so much better to have that stuff out of your body.
Fantastic. And so now that you're kind of on the other side where you've gotten to the point where I'm Sabrina again, you know, and you've been able to help a lot of people be back to that point again. What do they need to be on the lookout for? Because it seems to me that this is something that if you have a genetic predisposition, this is not like a fly by night, you know, I did the treatment, all right, here we go, right?
Yeah.
So what does that look like moving forward for someone like you and for the people that you care for?
So once you start feeling better, we've made it through treatment. What we tend to do is just keep an eye on your symptoms. So you know how you felt when you had mold. Now you might get some things back again, and it can tend to make you a little bit paranoid about molds as well. So we do some neurocognitive learning to kind of help process all that maybe trauma that we went through to get through the mold. So we're not so paranoid, but I tend to take a binder on a regular basis, just a herbal binder. I take coconut charcoal. It makes me feel better when I'm on it. If I'm traveling and I feel like I'm getting these symptoms back, or I have a musty smell in a hotel room of some sort, I'll just increase my binder. And if I get to the part where I'm just like, oh man, I'm just not feeling it again, then I usually seek out treatment, go a little bit more in depth again, and then we can, you know, just making sure. But I'm very diligent now about checking my house to make sure like there's no leaks. So I go around quite a lot now just to make sure that I don't have to go through that process again. But it's just as simple as just keeping an eye on your symptoms, you know, and taking the herbal binder here and there can really help.
Awesome. So when you say you go around your house looking for issues, right? I've read that it can be as quickly as 2 days after water has infiltrated the home that mold can begin to grow, and it's pretty resilient from what I know. Once it's growing, the particulates, the toxins can suspend into air, go into the HVAC. So something very, very little can very rapidly become something very big. What type of things, when you say you walk around and you're inspecting your house, what kind of stuff are you looking for?
So underneath my sink, in most of my sinks, I have this alarm that can go off. If any water touches that alarm, it'll go off right away and let me know.
Oh, cool.
I've painted most of underneath my sinks with this paint that repels water. So it gives it another protection. So it's just not going straight onto the wood. So I have the alarms and I have that. And then, you know, we just make sure we keep the vents on when we're taking showers. And so we're just a little bit more aware of what we're doing inside of our house. And when I'm home, doors and windows are open. I'm letting the fresh air in. I'm letting the sunshine in. Sunshine can help kill mold biotoxin particles. Let them kill them, like open up the doors. So, get that fresh air going in. If we have to stay inside, we need some fresh air.
Yeah.
And I change the filter in the furnace more frequently than they were suggest to.
Yeah.
Yeah.
So interesting, because one of the sad things, and right here in my office right now, this thing is built to be sealed, right?
Right.
No air circulation is possible in a lot of these modern buildings. And now I'm even seeing homes and apartments that have decreased ability to really open up to allow proper air circulation. And I'm so happy that's come up, because what an important thing to, keep ourselves healthy. And
Right.
I wonder, so many people from so many different socioeconomic levels right now that are being asked to stay stuck at home,
Right.
And they might not even have the ability to create proper airflow in their house. How likely it could be, that they might become sick from these very guidelines. So,
And
so interesting.
hopefully people will hear this and seek out some help if they notice any of these symptoms, because it's a lot easier to treat conditions, even illness, before it gets too bad. It's a lot easier to reverse things. Like, I am so happy, I am 41 and had a healthy child after all of this, and I think that's only because I figured out what was wrong and was able to clear those toxins out of my system, because mold toxins can cause congenital defects too, so
Yeah.
it's really important. Even younger population, old population, this affects everyone. So it's really good to get the word out there.
Fantastic. Sabrina, I know that you have a very busy schedule. I can't begin to thank you enough for sharing of yourself, of your knowledge, your personal experience. I mean, you've gone very deep in something that I feel like it's very intimate to your process, to how you've made these discoveries, but I can also see the love and the intention behind your ability to open up, to really let people know, hey, we are quarantined,
Right.
no ifs and buts about it, right? But, be aware, because this stuff is so prevalent, even in newer homes. It can happen in older homes. It can happen in apartments. You don't know what the
It can
person
happen in
upstairs,
Arizona. It can happen in Florida.
Yeah, absolutely.
It's everywhere.
And so, like you said, people are stuck in their house. They're decluttering. They're moving stuff around. If you start feeling weird, right?
Right.
Hey, it might not necessarily be coronavirus,
Right.
right?
Right.
There might be other things within the home that could be driving illness. And so excited to have you on. Is there anything that you would like the audience to know or to consider before we wrap up?
I just want to mention, mold is one of the biggest immune suppressors around. Like, a lot of illnesses stem from mold. Like I said, I almost had Crohn's or colitis and Hashimoto's thyroiditis, and all of this was because of mold. And right now is the most important time to take care of your immune system. I mean, you can't go anywhere without hearing something about your immune system at this part, and how to support your immune system. And yet when I would go to the store, I would see, the toilet paper is gone, but the supplements are still there, so we're still not quite catching on to the fact that we need to support our bodies, and ways to do that is to reduce the toxic load, figure out what's wrong with us, and then support our immune system. So when viruses like this come around, we're not so fearful about our health. We know that if we get it, then we're going to get over it faster, and we don't need to be so fearful about everything, but it all starts with you.
Excellent. So if our listeners want to be able to work with you and would want you to consider their individual cases, where are you at? What's going on? How can they grab a hold of you?
I guess the best way to get a hold of me now is through my email. So you can feel free to email me, sddcally@hotmail.com.
Can you say that one more time a little slower, please?
Sure.
That was very fast.
SD as in David, D as in David, C as in cat, A as in apple, L as in Larry, L as in Larry, Y. So sddcally@hotmail.com.
Excellent. Any other route of communication, or is that the preferred?
That's probably the preferred at the moment. Or yeah, I think that would probably be best at this time.
Okay, excellent. Thank you so much, Sabrina, for being with us today. It's an honor to get to learn from one of the masters, and
Thank you.
enjoy that beautiful baby.
Thank
and the
you.
rest of your day.
All right. Thank you for having me.
Bye.